It's a pleasure to see you here.
Thank you for the invitation.
Well, you know, this is it's very important that we at the ERAS Society meeting actually gather all the different stakeholders, and obviously one of the most important people in healthcare are the managers of the hospitals, because clearly you have to take the final decisions where you're going to put your investments and how you're going to move things forward. Maybe could you give me just a few words about what the challenge is for the future, the next 4 or 5 years, as far as development, costs, and what we're in for?
Most important challenges for us in our hospital will be probably the new models of care. That means more transversal, more integrated, and also with more interdisciplinarity.
Yeah.
That's very important because we know very well, and there is a lot of evidence that we cannot make a decision on our own. We need to work together with different specialties, and also with different interprofessionality is also a very key issue, and probably also the length of stay issue is also an important part, and also to launch evidence-based practice.
Yeah.
And standardization of care.
Yeah. Well, I think what the ERAS protocol has shown to be delivering is actually less variation in care, and also less variation in outcomes and better outcomes in different ways. How big is the economic pressure on healthcare today?
Well, it's a very big pressure. I think in Switzerland, and especially in our hospital, we are under less pressure than in some other countries. But anyway, it's a big pressure. And what we have to do, if we want to invest somewhere, we have to save somewhere else.
Yeah.
And it's a closed system now. We cannot have extra money.
No, there's no extra money coming in. No, in Sweden, where I'm from, we're basically facing a situation where we're going to have to deliver more care at perhaps a reduction of costs with about 2%. There's a 2% difference in what we need to do compared to the cost that we could put in. So there's a constant drive to get better care at cheaper prices. So how do you find introducing the ERAS concept in your hospital? How has that helped you? How does that fit with your needs?
Well, there are wonderful outcomes. I mean, in the loss reduction, but also improvement of indicators, as I shown this afternoon, and also a better way to work in teamwork. Yeah. That's a main issue, and I mean probably also to help and to have such approach completely supported by the clinicians. And which makes sense for them. Yeah. That's also a very important point, because it's not a top-down approach. No. And what impressed me is that all this dynamic and all the engagement of clinicians in order to implement ERAS and the standardization.
Do you think the key for that success is that you have opened up a different kind of communication between the leadership of the hospital? Or maybe you had it before, but in many places there seemed to be sometimes a gap, especially in big institutions. But if you have the roots with you, so to speak, the people on the floor and the leadership of the clinicians, it opens up. Is that your experience?
Yes, certainly. I think it's a mixture of different elements, but there are 3 key elements for that. The leadership of the head of service, wanted this implemented in our hospital. That was the first thing. And the second thing is that I think we accepted, well, the board accepted to invest with some resources, which is a key element to start with ERAS. And also the teamwork which already exists between the anesthetist and the surgeon, and it was there was all those elements which helped a lot to have a smooth implementation of ERAS.
You talked about the investment. This is something that when we, from the society's point of view, talk about this, many hospital managers and even heads of departments who have their own budgets will say we can't afford the investment. What's your comment to that?
Well, if we need to change some rather deeply in the way to organize our care, to use evidence-based practice, even if the evidence is not so great in every part of the ERAS program, but we have to standardize our practice, to limit variation, to better inform our patients, to empower them, to improve the teamwork with nurses. So it's an investment. So you cannot.
But they say we can't afford it, is what they're saying. It's too expensive. We can't afford it. Is that actually true, or are they just fooling themselves? What would you tell them?
I would tell them try to do it, or to do it progressively, because the return on investment will come very quickly.
Okay, I think that's a very important message, which I would like very many managers to hear, actually, because I'm absolutely with you on that issue, and I think this is it's a very important message.
If they can invest on an MRI, it's much cheaper. It's much. Not. It costs a lot of money. But for ERAS, it's not so much money. But of course, it's. We can have a return. The return on investment is a different kind of than implementing a new MRI.
Yeah, sure, absolutely. Now that you have you started with colorectal surgery, and what is happening with the rest of the hospital in other disciplines?
There was great interest of some disciplines, for example, of urology, of gynecology, and for other disciplines we have interest, but not yet commitment of head of service. But we work on a better commitment,
so
and
it's coming.
Yeah, absolutely. So I think we don't have to make ERAS a big thing. We have to go also slowly. It has not to be a mud. It has to become slow.
You let people find out themselves, and when they're ready, you let them go.
Anyway, we don't have any other choice, because if it's not led by the clinicians, it won't work. You cannot say from the manager point of view, listen, you have to do ERAS. It won't work. The clinicians, and especially the head of service, are to be deeply convinced that it's the right thing to do.
One last question is, how do you feel about, has this helped the reputation or the marketing capacity of your hospital? Has that helped you, do you think, working this way?
Certainly, because the population and the patients asked not only for great techniques, but also for empowerment, for good information, and for little things which help them to enhance faster. And I think it's a good way, to also...
So your reputation has come up, do you think?
Well, I cannot say that. I don't know, but I think it can help.
Well, okay, it's been a pleasure to have you here. We very much enjoyed your participation today, and it was a pleasure talking to you right now as well.
Thank you very much.
Thank you.